Testosterone replacement therapy, TRT. Now, this is something that I've been doing ever since I stopped competing for a few years now. So, everything that I'm about to tell you is from my own personal experience. And I would like to add that I am over 40 years old and I do get regular blood tests. So, I'm going to go through the positives, but I think it's also important that I go through all the negatives and then you guys have all the information to make an informed decision for yourselves. So the positives, obviously increased muscle mass and endurance, better mood, better mental clarity, better sex drive, better libido, erection quality is going to be better, which is something that people over 40 need to think about. Now for the negatives, honestly, if you're doing actual TRT and you're monitoring that with blood work, then side effects are really going to be minimal. Side effects start creeping in when the dose gets higher and you're not actually doing TRT, but you're doing a sort of low dose steroid course. And whenever you're taking something more than you should be, you are going to get side effects. You know, you can get side effects from drinking too much water. You know, paracetamol, everyone has two paracetamols when they get a headache and no side effects. But if you pop 10 paracetamols, you're going to be down the hospital and they'll be pumping your stomach. So it's dose dependent, and providing you're doing it properly, side effects should be minimal. I personally haven't really had many negative side effects, but everyone's going to be different. So the side effects that you can potentially get are acne. If you had a lot of acne when you were a teenager, chances are you might get some acne when you start testosterone replacement therapy. I personally don't really get any spots, so I guess I'm lucky. Cholesterol will go up slightly, but if you're doing the actual TRT doses, it's not really going to go up by much, and I don't think it's going to be anything to be concerned about. But again, check bloods regularly and keep monitoring cholesterol. If it does go above the normal range, then you have to speak to your doctor. Male pattern baldness, again, that's going to be genetic and it's going to be person dependent. I've got a lot of hair. I have noticed my forehead has gone a lot bigger than what it used to be. Whether that's down to age or testosterone replacement therapy or a combination of both, I don't really know, but it is a side effect that some people will get. Testosterone stimulates your kidneys to increase red blood cell production. So your blood's going to get thicker than normal. So that could mean that you potentially at a risk of heart attack, strokes, and blood clots. I do monitor my bloods regularly. My blood is thicker than normal, but it's at the top of the normal reference range, and it's not something that I'm too concerned about. Long-term exposure to testosterone can enlarge your prostate. That's going to happen with age anyway, but testosterone can speed up that process. So again, it's something that you need to monitor. And I keep a very close eye on something called prostate-specific antigen (PSA), which again I monitor via blood work. Testosterone converts to estrogen, and that could lead to side effects such as high blood pressure, water retention, and gynecomastia. Now, we can control this process. Again, it's going to be dose dependent. So, if we're taking the right amount of testosterone, then these side effects are unlikely. However, we can control estrogen with an AI, an aromatase inhibitor, such as Arimidex. Or if you're just taking one jab of testosterone a week for your TRT, we can split that up to Monday, Wednesday, Friday, or even everyday dosages. And that just avoids the massive spike that you get from one jab of testosterone. The higher the spike, the higher the conversion to estrogen. Sub-Q injections, so injecting into the belly fat can help. Again, that just slows down the release of testosterone, because when you're injecting into a muscle, that goes quicker into the bloodstream, whereas sub-Q will slow that process down because you're injecting into fat. Diet and cardio will also help to control water retention and blood pressure. Now, everyone that takes testosterone will suffer from testicular atrophy, which means that your testicles are going to go smaller. Now, that kind of sounds funny, but it is an issue, because what happens is that your body recognizes that you're injecting testosterone. So via the negative feedback loop, it switches its own testosterone production off, and therefore your sperm levels are going to decrease as well. So if you are wanting to have children in the near future, this is something that you really need to seriously consider if you want to start TRT, because your sperm will reduce, your fertility will reduce. To combat that, some people will take HCG along with their testosterone. Right dosages. So the normal range of testosterone is between 8.64 and 29 nmol per liter. I have had clients who have been in this normal range somewhere around 10, 12, 15, and they've experienced all the symptoms of low testosterone. So we don't want to be in this range. We want to be in the high end. So around the 28, 29 mark, so we can experience all the positives of TRT and minimize the side effects or the negatives. Anywhere from 100 to 200 milligrams of testosterone per week is going to be about right to get you to that high end of normal. Now, of course, the right way to do it is to get regular blood work to confirm what your dosage is, because it's going to be very individual to get you to that high end of normal. So the 27, 28, 29 nmol per liter.